So a couple of years ago, actually, I was out to lunch with a friend in Kansas City, and I picked up my phone and looked at it, and I saw that I was invited, along with other WomenHeart champions, to come to the White House. I couldn't believe it. I never thought in my entire life I would receive an invitation to the White House. So of course I came, as did other women, and we had an outstanding conference, a Q&A with the current administration, where we had an opportunity to ask questions about what was going on with heart legislation, and of course they talked with us about what they were doing. It was an extremely proud and special moment of my life, and the importance of that too is that we were making an impact with the administration, who had some power to do something about it.
Advocacy is far more than just coming to Washington, coming to Capitol Hill, and making sure that Congress is doing the right thing. By telling your story, by stepping forward and speaking out loud, you can make a difference, and ultimately this advocacy will save lives.
Going to the Hill, I think it can be intimidating, especially your first time. But after a few times of going to the Hill, it became very simple. And for the most part, I believe that the members of Congress and whoever we got to speak with, they truly heard our stories, and I think they got it.
Members of Congress and their staff are very affected by women coming and telling their stories. It makes it real to them. It's not just a statistic, it's not just a number on a page, and if it's from someone from their state or their district, they take it very seriously because it's who they feel some responsibility toward. So having an advocate come forward, a woman with heart disease with a story to tell, can make a big difference.
In that regard, WomenHeart has been a great partner and a great advocate in basically presenting the value proposition to our policymakers and to the American people to recognize the importance of biomedical research, the importance of women to participate in clinical trials, and more importantly, in many ways, providing that social support necessary for women who are struck with this heart disease, and finding ways to help them bounce back or prevent further complications.
Advocacy for women and heart health can tackle a number of things. I think we need to really advocate for expanded research, and a lot of that is funded through the National Institutes of Health, but also in lots of other ways, and we need to really insist that we learn more about the risks of heart disease for women, the proper ways to diagnose it, and the proper ways to treat it. Advocacy can also ensure that both women and physicians and nurse practitioners and other folks who take care of patients know about the risks of heart disease, the symptoms in women, which can be different, and again, the treatments. What are the proper treatments? So we have to make sure that advocating for women and heart health is a priority for the advocates, but also for the laws and policies that they can affect.
Advocacy impacts a lot of things, but more importantly than anything, it affects our funding, which through funding you get research. Through research you save lives. Your call to action when you walk out of this classroom is to go and educate yourself and to go and educate other women and help them learn how to advocate, how to ask questions. Get out in your community, talk about WomenHeart, talk about what you've learned in your training.
So when women complete their training, the most important things for them to take forward with them, in my opinion, are first of all to be comfortable with the process, to realize that our elected officials are elected by us, and then to understand that they make decisions. Congress makes decisions constantly about funding of various initiatives as well as the types of legislation that they want to pass. And we need to be there. They're not going to advocate for us, we need to advocate for ourselves.
I want you to be strong. I want you to be confident. I want you to go out there and tell other people your story. Don't be ashamed. There's nothing to be ashamed of. Do something about it. You could be saving another woman's life.
People often ask if really one person can make a difference. And the answer is yes. Now you need to do it with a bunch of other people sometimes, but one person can make a big difference. If you're advocating with at every level, you can have an influence far beyond that. Whether you're talking to the media, whether you're talking to members of Congress, city council people, the recreation department, you can make a difference. And I think it's really important to think that although you think you may be just one person, you can truly make a difference.